Hello, Dr. Jocelyn.
Hello, how are
How-
you?
I'm doing good. Long time. How are
Finally,
you?
we make it.
Yes.
So
So it's
good.
not too late for you, right? It's like
No, it's very good. It's
perfect,
very good. It's
perfect.
early for you, but 8 o'clock, eh?
Oh no,
Is it?
actually, I could do even sooner than this. And I'm thinking
Okay.
early my time, evening for you guys works perfect. So
Yes,
this is going to
exactly.
be. So since last time we met,
Yeah.
DNA got clearance in Dubai. Yay! So that's
I know.
awesome.
I mean, I'm so impressed by Mr. Nader that he did that because it's complicated here.
It is very complicated. And also, he's working diligently to get us into all the correct spaces. And I
Yes.
told him that what we are planning to do in Middle East region is we're going to onboard all of our devices and sleep appliance treatments, some of which you're familiar with, but
Yes.
the care appliances, and let me explain to you what care appliances are. Basically, the appliances that are DNA, mRNA, things that would change trajectory of the mouth, basically appliances that would get activated and all that. We're going to really do direct coaching with doctors like yourself, and I have put you on my A list because you have tremendous experience with all other modalities, so you're very easy to coach. That way we can work together safely treating patients. So one of the things that I told Nada I want to do is before I come out there and like hold your guys' hand through the process, is working with you in the screening process. The
Yes.
most important part is who's the right patient for treatment, what am I trying to achieve with it, and how to do this interdisciplinary. As we say, it's a complex condition. It comes with a lot of compensation you're going to unwind, and it requires collaboration. How do we put those C's in order?
Can I interrupt you a
Of
second,
course,
Bahar?
please
I
do.
just want to know you registering the this. Can I register too?
Absolutely. As a matter of fact, I will go ahead and upload it to my YouTube and send you a link. But I can also give you
Oh, I
permission
love that. I
because
love that.
it's I all of my consults with doctors gets uploaded so they have access to it. It's easier.
Yeah.
And yeah, your last one
Okay,
is up there
perfect.
too. I will send you a last one as well.
Perfect.
Perfect. Excellent.
I appreciate it.
So yeah, of course. So there's one thing that let me just close the door to make sure that it's quiet. So the one thing that I'm going to mention here is where we're thinking this whole process is going to have some hybrid of training. Some going to be online, some is going to be in person when I'm going up there. Some of them is going to be on Zoom coaching. We're basically you're some of the first doctors, so feedback.
Yeah.
And the way I have done it, and I've done this with Dr. Arjaman and with a couple of her patients, is I will basically give you clues as to what it is we're screening. What are the things that we can treat? And more importantly, I definitely want you to start focusing on building a team. A team is dentists that works closely with chiropractors, physiotherapists would be great. We provide myofunctional therapy, but also, if need be, a medical doctor that can do other things that dentists cannot do, namely
Yes.
CPAP if they need one. I mean, not
Yeah.
everyone, for the time being, or managing their inflammation. Inflammation is a huge, huge one, especially in some areas, mold toxicity or food allergies and sensitivity, things like that, that can be inhibiting to your treatment because anything that causes inflammation, congestions,
Yeah.
it's going to be a setback. So we want to address those things in the right order for whatever it is. So we have three buckets. We're going to have three buckets. We're going to assess the patient. How is the patient mentally? How's the patient orthopedically and physically? How are they biochemistry, lifestyle? All
Yeah.
three of those are intermingling the complexity. That's the complexity
Yeah.
part. Because the part that
Yeah.
you can address is probably one of the biggest stones in the jar,
Yeah.
orthopedics. Because when your orthopedics are off, your breathing is off, your nervous system is off, your nerves are not functioning properly. So yeah, I could see digestion and hormone get affected, and you would just, to some degree or another, emotional, mental, emotional can be affected. But to what degree? So that whole assessment part and grade of the degree of complexity is probably the most important piece. Let
Yeah.
me share with you real quick the sample of the sample form, and I will send you this form. I just sent it to Nader as well. This is what I do use for patients, and if I would love it, and I'm gonna automate this so that you
Okay.
don't have to fill this out by hand. But this is basically the premise of the initial screenings. Let me just go ahead and put this in the middle. Do you currently have a patient that we can probably execute this if I show you the
Yeah.
You do?
Yeah, actually, Dr. Nader, sorry, Nader sent me a patient
Oh my
that he
gosh.
wants I try Vivos with him.
Heck, let's
So,
get
uh,
started. I will tell you what
yeah,
I
I
need.
mean, I will see him Thursday. So
Heck,
tomorrow,
I
yeah, I'm
actually
seeing him
told
tomorrow.
him. That's so funny.
Good,
I,
huh?
well, I told him I would meet it with you, and I told him that, okay, I'm going to go ahead and get her started as far as what I want. I send this to him, but this is the gist of it. So, this is
Okay,
gets filled by the patient. Obviously, we want to know the name, date, and the source. So, I would like to know this is your patient because I get lots of doctors sending this. The first 10 questions are the most important, and I borrowed, or not borrowed, this has been building over the last few years. I've been basically
okay,
saying one of the most key questions. I can give them so many different questionnaires, okay, and they mean nothing. I want to ask questions that immediately tell me, who is this patient? Where are they coming from? And how
yeah,
did they become so dysfunctional? So that I can remove the biggest splinter in the system. They're more likely to go through the other rest of, like, let's say that you have a toe that's hurting, okay? If your body posture is changing to avoid that toe, and then now you have a pain on this side, and then you can't, your clothes don't fit right, just in avoiding that one toe, okay? I can address all those other things down the stream that you're adapting to that source. But would it make sense if we fix that toe so you come to alignment? It's like, wow, I don't need to, if my shoulder is like this, I don't have to change all of my clothes to fit that distorted posture. All I gotta do is make the posture not do that avoidance. That's the goal. Where is the biggest drip, drip, drip? Like sink, okay. You see the floors are wet and getting destroyed. They're soaked in water. But if you take a look and see that the sink is overflowing, the sink is plugged, and then the faucet is dripping, okay? Which one
yeah,
of those problems would you tackle first? I bet you changing the floors makes absolute no sense. Mopping
yes,
doesn't make sense either. You gotta drain the sink and stop the faucet. That's the goal. Where is that for that patient? And it's not always the same place for everyone. It could be a combination. And it could be
yeah,
something that have been accumulating from birth and pre-birth. That's why we go as far as that. And these are the parts that right now not being addressed. And you would be amazed when you follow this, how many people come along and say, you're right, these are the things that I grew up with. When you start asking these questions, sometimes you would boil down the time of the start of the symptoms is a particular incident, in some cases braces. I had two young ladies, complete fatigue, I call them the fit female syndrome. They have fatigue, they have neck pain, they have breathing disorder, clenching, they don't have apnea. Dysautonomia is what I call it. And when we got down to it, when did it all start? 12 years ago. What happened 12 years ago? She got into braces. I'm telling you, you unwind and to remove the layers and layers of onion, that's the goal. So this is the first layer of onion. If I give this question to you, and I'm not sitting in with you, and you just fill this up on your own, and I ask you between a score of 1 to 10, 1 being poor, 10 being ideal, describe to me your physical health, your mental health, your daily work stress level, daily or social stress level, home life stress level, ability to handle new stress. It's very important. Then I ask about sleep quality, hormone balance, and ability to get enough sunshine. So basically, if you have physical stress in your body, and then you go in for a run or the gym and you stress your body even more, and you have no
yeah,
other outlet, and the daily social life come at you, you're exacerbating this by virtue of the fact that you have. Can you work on your daily social life stress? Do you meditate? Do you pray? You can things like that. Because when you have 3 buckets of stressor, you have outlets. And if you have no outlets, that builds up. And then the
yeah,
physical stressor gets exacerbated. All you see is your TMJ. You see their neck pain. You see their breathing disorder. And worse off yet, all you see is this sleep quality and duration. Okay, let
yeah,
me tell you why. Because if somebody tells me I can't sleep, a lot of people, when you're doing sleep breathing disorder and you have appliances, what have you, you say, whoa, it's going to be breathing, right? And I see dentists make this mistake every time. It's a rookie mistake. Okay, well, describe to me why your sleep quality is poor. I can't sleep. Yeah, but then do you have trouble getting to sleep? Do you have trouble maintaining sleep or transitioning? You're a light sleeper. You wake up every night at 3 in the morning. In the morning, you're sluggish at 3 o'clock in the afternoon. Everybody says, well, yeah, because they can't breathe at night. Not so fast. You know what? We need to go through stages of the sleep. Neurotransmitters, acetylcholine, melatonin, things like that. And if their body is overcompensating or it does not, the gut is not support making them, guess what's going to happen? They're going to have trouble transitioning through sleep and maintaining sleep. Would it make sense to have a functional medicine checking them to see if they can methylate properly between those hormones? They're depleted of serotonin. They can't have melatonin, and you can't supply that. What body makes should not be supplied. Let's work on methylation support. I'm just giving you a very brief example, and you think, oh my gosh, this is complex. Not really, because when they tell you where their scores are, and I will go over a couple of patients, you'll be like, this really could have built itself out. If it's not this, it's that. If it's that, it's not this. And you come down to the bottom and say, you are a basket case of physical distortion and very little adaptive capacity, a body that cannot keep up with that stress. You compensate in other two. So if we simultaneously give you some support in your orthopedics and support you with better nutrition and maybe encourage you to reduce some of your mental stresses, avoid things that would mentally stress you, maybe daily work, just start working on that. Define what happens that you would start seeing the puzzle solve itself from there first. So this is the most important page for me, because I need them to admit to me who they are, and you need them to admit who they are. Because once we get into treatment, now we overpromise, and we don't want to do that. And a lot of times people become way more eager when they know their scores to improve the score. They don't know their hormonal balance is related to their neurology. Let me give you an example.
Yeah.
If you have a distortion, we talked about this guy last time, okay? If you have a distortion in the relationship of the occiput to base of the skull, okay? Distortion right here at birth or later on, and the sphenoid gets distorted. You know what sphenoid holds in the middle of it? The pituitary gland. For pituitary gland, that's a master hormone to control all the other hormones, thyroid being the most important one. It needs to move. And if you have distortion in the face, distortion in the skull and the posture, it yanks on this bone and it cannot move. When there's distortion in the dura that controls the movement of this, swallowing dysfunction, low tongue posture, head posture, all that affects it. The function of that hormone gets affected. Another thing that happens is right here, called the, sorry about the lighting here. You see how there's so many conduits of nerve here?
Yes.
Distortion in the skull and the orientation to the base of to the first vertebra, to the neck, all of those nerve functions, vagus nerve, hypoglossal nerve, accessory nerve, and fluid exchange. Blood going to the brain and blood coming out of the brain, venous drainage, arterial, blood flow, cerebrospinal flow that's happening majority in a foramen magnum, all of that gets impeded. Now what happens if the blood flow to the brain gets impeded? Oxygen delivery and removal of the toxins and CO2. What happens if cerebrospinal fluid doesn't move? Cerebrospinal fluid is the lymphatic drainage of the brain, and it doesn't work. Toxicity build up, CO2 exchange, breath rate, and sympathetic. Do you see how that's all orthopedically alone, leading to these causes? And when you see this, that they say reported my hormone balance is poor and they're young, a cycling woman, not pre-postmenopausal, I automatically think cortisol, pituitary, thyroid, lifestyle, what's going on? That kind of directs and shifts your level of thinking. Once you do this multitude of times and start from the big picture, we call this the biggest stone in a jar. Symptoms are like gravels. I got symptoms. Symptoms what brings them to you. Symptom is the reason why you have that conversation with them. What are the big stones that contribute to those gravels? That's the work of this first page. We've got to identify the big stones and then knowing who we need to collaborate with in the right order to address them. Because if the biggest stone that's causing their symptom is in fact orthopedic alignment, they get the biggest bang by the buck. And I've seen that, Dr. Jocelyn, putting a unilateral block system is one of our technologies on the correct side of the mouth, 90% of the cerebellum and neurology goes away. I have seen it. It's
I
almost like
believe.
immediate. Now, understanding that everybody, and it's so easy for us to get biased. All you see is what you've seen, and your brain looks for it. But staying unbiased is the difficult part, because what you think it is, it may not be.
I
I
believe.
love, actually, this is the part where I love sharing that joy of what I have learned, and I continue to learn through doctors like yourself, is now let's go deep to this and ask the
Yeah.
questions to see the next layer of onion. So the main concern, you have got to get this out of the way. We want to make sure, what are they coming to see you for? What do they want to address? If I always tell them, if I have a magic wand and I swing it and I had one wish to come true in 6 months or a year from now, what would it be for you in your health? Losing 50 pounds. I want to not have clicking in my jaw. I want to be out of pain. I've had a patient who tell me I would give up a limb, pick a limb, cut it. I wouldn't get a full night of sleep. I have not slept in 10 years. Now think about that, the weight of that, because when the expectation is set, now you know what you have to match. If their face
Yeah.
is asymmetrical, and we suspect that's related to the symptom, we address that,
Yeah.
but we haven't addressed the symptom, guess what? Your score for that patient is 0. We have got to understand and have the patient to buy in it. And believe me, when I get to this depth, it takes a doctor like you who has seen complexity to understand this is making it simple, isn't it? Like, hey, let me see who you are, how you got here, what you want to address, and let's see what's the highway that I can build between your symptoms and relief of, between your lack of homeostasis and creating homeostasis. How can we achieve that? It's a whole different conversation than I have a treatment and oral appliance, isn't it?
Yes,
So,
for sure.
and more importantly, if you want something addressed, let's say, I'm going to hypothetically say, this patient who wants to get a full night of sleep, how's it impacting your life? He cannot have a relationship. His job suffers. He cannot think future. I want to plan travels. My life is stuck. Or pain is debilitating from doing the things I enjoy doing, going to the gym and
Yeah.
lifting weight or running. I can't do it. How is it impacting your life? Because the weight and the grade that we assign to that, heavily important. Because now the focus
Can,
is,
can
oh,
I ask one
yeah,
thing?
go ahead, go right
Sorry.
ahead.
I just saw a patient. She's 24 now.
Yep,
I did a sleep study. I know she has bite issue and everything, but
yep.
she has posture issue. But you know what? She's on antidepressant
Oh my,
since the age of 12 years old.
oh, my soul.
It kills me. It kills me.
At
I
12
mean,
years old.
12 years old and she's
Oh,
24 and she's still taking the pills.
let's work on this. Do you have anything on this 20? Is this a patient in your practice?
Yes, I
Okay, I'm
just,
gonna
yeah,
email you this, and at the end of it,
yeah,
I'll tell you what pictures I need, and I will send you. Do you have access to a full CBCT machine that I can take a
yeah,
full
I
CT?
have it. Yeah,
Awesome. I will send you 2 videos that explains how to take the CT properly, and I want to make sure that
okay.
from day one, from patient 0, we follow protocol. The way you take
Protocol,
pictures,
yeah,
and I will tell you how to take them, and give it this questionnaire. Let's bring it on. Patient 0.
yeah,
I'm not waiting
yeah,
anymore. The world is falling apart with 20. My daughter is 10 years old. I have that child at home. And trust me, if I was not who I was, I would have probably break in and say, yeah, give her meds. You know what I'm saying?
yeah. I know,
Because I
I know.
know this is all the damage done from lack of growth and development. And maybe
Yeah,
there is some component that is underneath of it. There's emotional stuff. Like I know there's a whole host of people that do deal with emotional, that's underneath the somatic. But the fact is, when you see distortion in the posture, you become such intuitive practitioner when you get down with people. I'm so excited for you because I just know that from the first time I met you, I know not every dentist wants to be at this level. And you're not a
no, I
dentist
know.
right away. You're not a dentist at this point. You are on your way to becoming an airway architect ambassador because I need ambassadors and healer, truly a healer. If you are not in it for the long gain of the patient and helping them in that journey, and guess what? When you do that, the joy that comes back to you, I tell you, I
It's
would I
priceless.
not look back. It's priceless, priceless. Because 24-year-olds who are not on meds and can make good decisions, guess what? Now you're a part of that. Now you're a part of that. Because you probably are the only practitioner who will ask these questions or
Yeah,
ask
I
about their
know.
digestion or about their diet and lifestyle. Jocelyn, I've had patients, a 26, 24-year-old that came in,
Yeah.
all of those distortion. I'll show you her case. I probably have already. And she was in the wrong relationship. She hated her job. And by the time we were done, she established her own business. She got out of an 8-year abusive relationship. Even she came and asked for
Wow.
business from me. I mean, how cool is that? You see people's
Yeah.
lives turn around and say, you know what? This body that I'm stuck in cannot rule what I do with me. And
Yeah.
a lot of them would tell you, I want to do things, but my body's not keeping up with me. And most of that distortion ends up in the most important part right here. And
Yeah.
you're the only practitioner who will orchestrate getting them care. Trust me, even chiropractors don't notice, and they are way more hands-on with the nervous system than we are. I mean,
Yeah, then we are. That's true.
practically speaking, but really though, the dentist is at the tip. I am so glad to be a dentist of all professions because my goal is to empower all dentists to gain that respect. We already done that. Vivos have already
Yeah.
done that. We have gained you guys your seat at the table. Now your treatments are equivalent of what medical doctors sit across from them and tell them how
Yeah.
much of the mouth distortion is causing autonomic dysfunction and all the functions that is, the digestion, the nervous system, the
Yeah.
hormone
Yeah.
system cycle affected by it. Yeah, it's
I'm so
exciting.
excited
Are you
to
kidding?
because
I know. Believe me, I told Nader, I don't need hundreds of doctors. I mean, yes, I do. I do need because there's a lot of patients. I don't need
yeah.
every doctor to be as expert as you and I are, right? I need them to screen exactly like this. But when it comes to treatment, you are going to be my ambassador. You're going to be my hands and feet coaching and helping these doctors. So consider this the start of your journey, which we already started.
Oh, thank you.
I know,
I'm
right?
I
It's
know. Do
amazing.
you know Dr. Rashida?
I have not heard of her, but no, I think
Because she did
another.
Viva. She went to do the treat.
Oh, is that
Look,
Tina? Is that Tina?
no, not Tina. Tina, no, I know she did Vivos also, but Rashida, Dr. Rashida did Vivos also.
I have
And
not heard of her. I might have seen her, but I don't know her by name. It's likely because I know pretty much
yeah,
everyone
probably. Yeah,
that does
makes
Vivos.
sense.
I know them. So listen, I
Yeah,
honestly I love this treatment so much. I want every dentist at whatever level they are, they have access to them, even if they're not expert. Help them. I can help them. Treat the simple
yes,
patients. And this is what's going to help me know, okay, who's a simple patient, who's not a simple patient. And if they're not simple, okay, maybe an average doctor should not treat them because they don't have the bandwidth, they don't have the patience, they don't have the, for that matter, all the specialists they need. But you will have, and I think one of my patients that I found through Dr. Arjamand, she just emailed me and said, I have a chiropractor that's interested to collaboration. There's two that I found. Another has a few.
Dr. Arjiman.
Dr. Arjamand has sent her the referral. So the patient is actually a
Okay.
psychologist. Yeah. And I would like her to meet
She's
you.
what? Sorry, I didn't get you. She's a dentist?
No, she's a patient, but she's a psychologist.
Oh, okay, okay, okay.
Yeah,
Good.
I'm telling you, I'm already kind of like putting my fingers in your region because
Yeah, yeah.
I want to have all of the team members I have here. We will train them for you. I want to have them over there. Like their level
Okay.
of care should not be different just because it's in US in Colorado or is in Abu Dhabi. It should not be different.
Yes.
It's just
Yeah, I
the
agree.
language we speak, right? But the language
Yeah.
of health is the same. It's not Arabic, it's not Persian, it's not the
Yeah.
language of health is the same. Your 24-year-old and my 12-year-old suffer the same disease. There is no borders, there's no language barrier in that. Body speaks the same language no matter what. Isn't
Yeah.
that true? And we're going to
That's
speak
true.
autonomics for sure. You make me
Good.
excited.
Me too, me too. So we feel the same.
I know. I know. So, and also, we want them in parentheses. What is your desired outcome from the treatment? Have this in parentheses because if not only that is going to put it on the top, you need to hit it, but also tells you who else need to. And that is the most. So the first three questions here, and you see how it's not a yes or no. I want them to say it. Speak your truth. Put your thought in your mouth and speak it because now you own it. Now it's out there. When I say yes or no, it's not a part of their story. I want them to write it down. Then we're going to start asking. You see, I have categories that I have
Yeah.
yelled here. So basically, this is going to start reverse engineering from Obviously, this is a more of a probing question. So a lot of people don't know about their birth, or they do know about their birth. They need to be willing to share. When you ask the question, if they're not willing to tell you now, they will tell you down the road. But you ask the
Okay.
question. I had a 50-some-year-old patient that I'm telling you all these little stories because that's how I put this form together. She came to see me 2 years ago and had a complete distortion on the right side of her face. Now we're gonna get to, when I get to fully train you, right side pattern is the most difficult case you will ever treat, especially if their adaptive capacity is down, because body has to compensate 4 times more for distortions on the right side when they are non-smooth. Anyway, so she cannot open her mouth more than 34 millimeters, and she wants treatment with a DNA so bad, and pelvic distortion, cranial distortion. I told her, no, we gotta start you with, the proper order of things. We work with the SOT chiropractor. She amazingly responded well to it, and even her faces start changing. Then I gave her the unilateral block system without giving her the DNA. She starts seeing a lot of changes happen, and the body has now removed a lot of those distortion by virtue of every swallow, removing some of those distortion. And then she's in a DNA with the block, which I will show you how to do, about 6 months. Loves her treatment, her symptoms. Now the body is coming to the surface. And she told me last time, a year and a half into full-on treatment with me, she said that I have been diagnosed with the with the connective tissue disorder that basically fascia is building fat within muscle. I've never heard of this. And she said, now
Me
they're going to,
neither.
that they're going to surgically remove them because it's causing a lot of pain. She said, but this was always here as well. And I said, wait a minute though. My heart tells me I'm not okay with the surgery. I think
No,
there's more to the story. And I
especially in
said,
the head, they want to do it on
especially, no, this is going to give you chills. And I said, I have a suspicion that your body, as we're untwisting you, there is more that's coming to the surface that was the cause of this before even you were born. The minute I said, she said, you want to tell me, I did not feel safe to tell you this like 2 years ago, but when I was still in the womb, my mom found out she was pregnant. My dad told her, you need to abort the baby or I'm going to divorce you. And she went on to have me. And at the hospital, when I was born, he came and gave her the divorce papers. And she said, that has been a part of me. And as I'm going through this process, that has been coming to the surface. And guess what now? Now it's exacerbating itself into this bundles of fascial distortion. And I said, that emotional aspect, which is why I told you, you need to go and release that emotion. There are people that do this, or experts safely do that. Your body gets that energy and now twisting somewhere else because we're untwisting this. Jocelyn, I'm not being esoteric saying this. This was not an issue 2 years ago, but now that we remove the distortion, we're telling the body, okay, now you're this whole symmetrical thing. The body goes, I'm not done with that emotion. I'm going to bundle it somewhere else. And that's where it went. And she sat there and the tears come down. It's like the body will tell you that, yes, that is true. No, I'm not releasing that, not in this space right here. And those are layers of onion. Understand that people have gone through stuff. When you see something in front of you, it's a byproduct of everything that happened to that patient. And they will tell you and release that to you when they are ready. You cannot force them, but ask the question and provide a safe environment for them to tell you about it.
Yeah, okay.
Isn't that hitting home for you? Isn't that hitting home?
Yeah, yeah. I mean, already, it's just that I already see some patients that I know they have some trauma when they
Yep,
were young. And
yep.
it's showing when they talk, and I can see it, but I don't bring the conversation there yet.
You know what the fact is?
Just,
We're not, consider this, you're not a practitioner, you are not a mechanic, you are a healer. You believe that in your heart. And I tell you
yeah,
what,
that I know I'm a
the
healer.
doctors need to believe that in fact they are healers. There's evil in this world and people are suffering mentally, emotionally, environmentally. And when you get a chance to be that safe environment for them, maybe this is the only time they get a chance to pick the right choices, to get in and release a lot of this baggage they're carrying. Why not be that? Why not work with a psychologist that actually, and I don't believe in medications, like I want this child, that patient of yours, off the medications. Why not provide a safe environment when body is releasing this trapped emotion and trapped frequency so it's not affecting them elsewhere? Because body has frequency with every organ now.
Yeah,
Shame, guilt, things that they even inherited from her parents, like this patient
yeah,
that I just described. She inherited that before even she knew she is a person, before she had frontal cortex. Now the body has not dealt with that frequency and being stuck in places that it can that resonate with that frequency. Now that organ function becomes impacted, the gradient of polarity becomes impacted. Now the body is disconnected. So they have digestive and hormone issues, and all of that is psychosomatic. I've seen emotional release by virtue of touching them where the emotion was stuck. I'm not making this up. And unfortunately, the world of Orthodox medicine want to believe that we are treating a mechanical being, and that is not true. Again,
No, it's an emotional being.
this is an emotion. We are more sensory than motor. We are more energy than matter, and we are not dealing with humans as in fact what they are. And I don't believe that doing what we do, again, is this difficult to treat patients this way? I could tell you what, not knowing what I know was difficult. Right now, I'm sitting very pretty. I feel comfortable. I can help any doctor anywhere in the world because I don't know what to do for any patient. Their body tells me, the body tells me yes, no, yes, no. I will show you how to do kinesiology testing. The body will confirm every single time. Yes, that was a good
I
move.
took
No,
the
that was
first course. I just took the first course of kinesiology.
When I come to Dubai, this is where I absolutely have to do this part. I will show you in real time how effective it is. But again, the part of that is the belief system. A lot of dentists tell me, oh, you didn't push hard enough. You're not ready to accept this. Believe it or not, the doctors that are not healed themselves, they cannot heal somebody else.
Exactly.
They
I
can't.
agree 100%.
You know what? I tell you, God is so good. Has already, like you, Dr. Arjamand, a couple other doctors, one of them being a patient, I've already found the team that I want to work with over there. I feel like this is a part of my mission to empower other dentists. And I know a lot of low frequency doctors have really been discouraging to me, but I already found some real rock stars that they're on the journey. Now, 2 is better than 1 and 10 is better than 1. And imagine if we all start treating patients this way and in a medical setting where they can see in real time, in fact, people are complex. That's it. I don't need to tell you how to treat. I can only tell you adopt and understand the complexity is there, and compensation follows that, and unit collaboration. If you believe those 3 and believe that bodies are smart enough to know what it needs, then all you have is, okay, which one of my tools fit that patient? Sometimes what the patient needed from me is that alone, the acknowledgement that you've gone through stuff, okay? Let's get your body what it needs, give it a safe environment to release the emotion. And when they come back, everything I do, it goes smooth. And when you have not dealt with that, everything I do is trauma and the body will reject it. And I feel like, well, this worked for that patient. Why is it not working with this one? They did not go through the same experience as one. I was born in the midst of war in a third world country. Do you think that every 44-year-old you meet has gone through my experiences? I've lived 3 lifetimes already. I had to reestablish myself 3 times. Do you think that every 44-year-old that was born into a completely different environment has the same? No. And all of that gets stored in, guess what? Fascia. Fascia speaks volume on everything that's happened to you. I will send you an article from a really good chiropractor.
What do you say? Fascia?
Fascia, Dora and fascia. Fascia is the electric sheath that controls and makes billions of cells in your body communicate to each other. Here's a quick lesson.
Okay.
Did you know why do we die when we don't breathe, Dr. Jocelyn? Why do we need oxygen?
Why we need oxygen? Because it's the source of life in our body.
Why?
Because everything in the world is made with oxygen.
Why? What does oxygen do that when we don't have it, we die?
Yeah, we die.
Why?
It makes energy. It makes everything in your body.
Explain
I don't know.
Like what is the lack of, what is oxygen doing that when it's not done, we die?
Yeah, we die. Everything, all
When
the
oxygen gets
function.
picked up, at the hemoglobin, right? It's not soluble.
Yeah, hemoglobin, yeah.
Where does it go? It goes all the way, travels all the way to down to the tissue, right? To every cell.
Yeah.
Every cell
Yeah.
gets picked up at the cell membrane. Where does it go?
Inside the cell.
Where? The powerhouse. What's the powerhouse?
Powerhouse.
Mitochondria. In the
Mitochondria. Yeah.
mitochondria, which in the mitochondria, there's 30 some odd steps, each one of them requiring a particular enzyme that you need to be genetically fit and nutritionally fit to provide. So all those steps happen in the Krebs cycle. Oxygen gets mixed with fat, combusted to produce what? 38 ATP.
ATP.
If you
Yeah.
don't have oxygen, that has to happen with the phosphate and the glucose inside the cytoplasm of the cell, not in the mitochondria, to produce 2 ATP. Not very efficient, is it? No. So what is the 38 ATP is used for? There's ATP dependent cell membrane pumps in every cell membrane that are used to do what? Moving potassium and sodium and minerals in
Yeah.
and outside the
Yeah.
cell to create what? Cell wall gradient, right? That is
Yes.
electricity. Electricity is the word I was looking for, polarity. Without that polarity gradient inside and outside and that wall, electricity wall, that is the start of the fascia. That is the fiber optic of fascia. We are
Yeah.
supporting
Yes.
that fascia by virtue, we breathe to support that electricity, which is communicating your liver cells to your brain. The way that billions of cells in your body communicate to each other is via that electricity. And you
Yeah. Energy. Energy.
exactly. Vitality is voltage, that gradient. So
Yeah.
the cell membrane vitality is somewhere between 25 and 50. That's
You
vitality.
know,
60 above is like vibrant. Below that is lethargic. When your voltage
you
drops
will have to write down this to me, but because I know all about
yeah,
this energy. I know that we are more energy than matter. That I know.
we are
But
supporting that
people don't think
vitality.
like this.
That's it. And the minute you cannot take the oxygen and you cannot support that oxidative, that's why oxidative stress brings your voltage down. One of the things we do is supporting, and that's why we have to look at the body as a whole. Oxidative stress. You can only do so much with the oxygen you breathe because if your mitochondria, and there's particular tests, functional meds run to check for the functionality of the mitochondria. And
Yeah.
that's why when you're sick, because why do we need that cell wall? Not only 40 billions of cells in your body as a whole communicate to each other through that electricity. Again, when I'm talking about fascia, let's get down to the dirty deep of it. That the dural matter is the fascia, exactly.
Yeah.
The most dense fiber optic in your body is your dura that's attached to your skull, to your tailbone, that basically moves the spinal fluid. We're this amazing regulating, self-regulating system, electric system. We're a battery. That's why putting your
Yeah.
feet on the ground will discharge the electricity to reset your cell walls, which is important for health. Under these artificial lights that we live in, our bodies are basically losing mitochondrial function, which is exactly what we need to be vital. Kids are on their shoes inside the sensory deprivation chambers on this artificial lights, breathing this. We wonder why they're so
it
sick.
affects your pineal gland, which
Pineal gland is a
produces the
whole another.
melatonin.
Pineal gland, I'm telling you, the piezoelectric activity of the pineal
Yeah.
gland depends on the
Yeah.
spinal fluid. Like all of it is connected. Yet we're looking at them and say, "Oh yeah, you just need to have a bigger mouth and a bigger palate." It's like, are you kidding me? Are you kidding me? You just look at the retroglossal space and tell me that if we can only increase that and cut all the soft tissue, they can breathe better. People don't understand respiration. What I just explained is respiration. Respiration is the effect of oxygen after it gets picked up, and it produces the end result. So when the cell wall is not healthy, what's inside goes out, what's outside come in. The integrity of every cell depends on the vitality of that cell membrane, which is why when a virus comes in, it attacks and get inside the mitochondria, and it makes the mitochondria do what the virus wants it to do. And when you fast, autophagy, the cells that don't have a functioning functioning mitochondria, they depend on the glucose in the cell cytoplasm. So after like 12 hours of fasting or 16 hours, they put a little spike up and say, glucose, glucose, can you give me glucose? And when you're fasting, your body goes, oh, there we go. That's a cell that doesn't have mitochondria and it's sugar. Your mast cells go and gobble them up and put them in the lymphatics and drain them. At 24 hours of fasting, your body will eliminate autophagy, is eating up the cells that have been defective, did not have a functioning mitochondria, and have been affected by viruses or what have you. Cancer is a cell that does not have any ability to produce oxygen for vitality. That's it.
Yeah.
That's it.
Yeah.
Given oxygen is not the most important function of the mitochondria. That's the part where I'm like, you need a functional medicine. What do they need? Methylation support? Do they need minerals that they don't get? Do they have lack of, that's why I ask, do you get sunshine? No. Okay, get your feet on the ground and get sunshine then. Your vitamin detox, your minerals and your bacteria that are supporting the production of neurotransmitters, they're not there. Oh, okay, you don't
Yeah.
have circadian rhythm. I could tell you why. Don't take things at the surface level and say that's what it is. And this is the part where you become smarter version of you every step of the way. And the more you understand your own body, the more you understand your patient's body, and you come back and say, well, maybe if we can get them a little bit of a support here as well, we can have a better functioning regulating system. That's it. Homeostasis through all the systems functioning together. Your job is raising their voltage. That's health. There's actually an amazing book. I don't think I have it here. Oh no, I didn't. If you want to read a great book, I met the author. Healing is Voltage, Dr. Jerry Tennant. Healing is Voltage.
Healing is the voltage.
Healing is
Okay,
voltage.
healing is
And you know
voltage.
what? He
Okay.
talks about the orientation of the skull bones. Mainly, look at that. Does this look familiar to you? This is what
Yes.
you do. The bowling ball effect, and he's talking about sphenoid, and where the sphenoid is positioned is affecting the functionality of that entire tension
Yeah.
membrane that would change the electricity and voltage. Do you see
Wow.
how important your role is in the whole grand scheme of health? Because I know I've been doing this and I just look at it retrospectively and thinking, how much did I miss not knowing this first 10 years of my practice? I'm glad I know it
Yeah,
now.
I know.
And I want to utilize doctors like you to be a channel to those younger doctors, like Dr. Arjuman's daughter, to get them
Yeah.
to understand total health right out of school, not 20 years into practice. Because you have 20
Yeah,
years worth of healing to do versus tooth mechanic to do. So,
exactly.
and we're only on page
So
one.
well
You
said.
see that? You see what I'm saying? We're only on page one. But you already discovered how did you make it to this world? And people will tell you stories where you breastfed. Because if they have tongue tie is just tip of the iceberg. What
Yeah.
created the tongue tie, which is a part of that fascial system, is also
Yeah.
affecting all the other part of the body. What contributed to if these two fingers did not separate apoptosis during the growth and development, you may want to know why. The same thing with the tongue tie. Again, I go back to folic acid, what moms are exposed to, a lot goes into it. We really haven't been able to explain tongue tie and the reason why fascia gets is not separating. I think it's just a cleft palate of our generation. It has a lot to do with what's folic acid, synthetic methyl, the fortified methyl that is added to food, basically what mom is exposed to, the baby is exposed to, forever
Yeah.
chemicals, who knows. Then you ask, I don't go out there and give them 15 questions. They don't even read it. Have you seen those medical questionnaires? Did you have this, and that? You're like, I don't understand what they say, so no to everything. So there may be a yes in there. I don't ask a yes or no question. I ask an open-ended question. I ask
Ah,
about
okay.
the ear infection, tonsils, and things like that because early on, that's a direct, it's not just the mouth breathing. When they have any of those ear infection, tonsils, enlargement, sore throats, that tells me this guy was distorted before they were while they were growing. There's a kink in the system from early on. That's it. People say,
Yeah.
oh, mouth breather. Yeah, but then what else? Why become a mouth breather? Is it, I've had people that have a giant airway in their mouth breathers. How do you explain that? It's not just the virtue of small airway, small mouth, tongue tie. It's almost like as ludicrous as saying umbrellas cause rain. Do umbrellas cause rain? That's what we see. Tongue tie is causing mouth breathing, or lack of breastfeeding is causing mouth breathing. It's like, yeah, you see the common denominator, umbrellas, when there's rain, but I can guarantee you umbrellas do not cause rain. Let's look deeper, be smarter.
Yeah.
And then I say surgery. Then I ask him if they had their tonsils removed, they will tell me. I need to know history. Tell me what happened to you instead of me asking 1,500 questions. And trauma. You do not, and I asked this very early because when they say, oh yeah, I had a concussion, you have no idea how many people get treatments from chiropractor, from this, and I'm the only one who discovered that I had a concussion at age 5. I roll all the way down the stairs and I landed on the right side of my face. And at which side? It's important because the brain got rattled to the other side. And
Yeah.
there's a contortion here, the symptoms happen here. Why is that important? Because if you're right brain dominant and your brain rattled to the other side, Houston, you got a problem. You know what I'm saying? That patient's difficulty just go up by 1 grade. Concussion's a huge one, especially athletes and young patients in contact sport. Ask them, do you avoid things in sports? History of trauma and accidents is super important. So they tell you, see how they have to write it down, and people don't mind telling me their story. And then anything in your history that I don't know to ask about. What is your medical history? Highlights, tell me about it. And medication. So very simple. I don't want to bombard them with 5 forms Tell me what, because if they say there is something, then I will dig into it. If there's not, let's bypass. Headache, very important.
Yeah.
Especially the nature, what makes it happen, what takes it away. So I ask all of those. What triggers it? What relieves it? Where? Describe to me. Dull, aching, thunderclap, sharp shooting. I'd rather any day of the week have aching, dull, not thunderclap, sharp shooting. When they have sharp shooting pain, we're talking nervous system. We're talking, because a lot of times dull aching is myofascial driven. It's distortion, it's muscles and fascia that are keeping you in a position where
Yeah.
you are compensating. When there's a sharp shooting, could probably impingement of, like, let's say hypoglossal nerve. And I've had patient that had burning tongue sensation from just hypoglossal nerve impingement early on in the occiput. And as you go through life, that nerve sheath right where it exits the skull, the myelination gets affected. It's like short-circuited, right? So that can cause that. But unless otherwise known, this could be something that a neurologist need to check. You cannot assume MRI, things like that. When you hear sharp shooting thunder, definitely I want to check it further. Where do you feel it? Is it forehead, behind the eyes? Is it side, one-sided, double-sided, right? Those are the constitutions for headaches, because when they have double-sided headache, both sides, you have to ask them, okay, side of my face, where? Is it in the front? Is it in the back? In the middle? Right here's postural. Back here is all contortion in the skull. Like, there is a reason why temporalis gets a spasmic. And basically, when temporalis gets a spasmic, it will limit the movement of the skull right here, which stops the drainage of the lymphatics through that tentorium right here, the sigmoid sinus. And if the lymphatics doesn't drain, the irrigation system does not work, guess what happens? The brain gets overworked, CSF fluid builds up, and when the CSF fluid, which we bring about 125 ml in our coronoid processes, gosh, I can't even talk today, inside the cord plexus that produce the spinal fluid, basically that flush system, the lymphatic flush system around the brain.
The glands, huh?
125 ml we produce a day, and it needs to be drained. If there is contortion, and I keep saying contortion, restriction of that fluid movement, CSF builds up. And the head, one of the jobs of cerebrospinal fluid around the brain and spinal cord is to make the brain feel buoyancy effect, feel lighter. Otherwise, your 12-pound medicine ball feels a lot heavier than it is. And when the fluid builds up around the brain, it reduces the buoyancy effect, and it causes a lot of pain, headache, and lymphatics not draining can cause neurological a lot of times brain wave production is all correlated to the level of toxicity that builds up on the brain, just from the irrigation standpoint, metabolic waste alone. Now, on top of that, if they had exposure to, let's say, vaccination, heavy metal toxicity that is now embedded in their cell walls, now they have a double whammy, don't they? Irrigation that doesn't work, sewage system backed up, and they have too much toxicity entering the system. Yeah, okay, that patient becomes autistic, Alzheimer. Hello? I already have seen paper after paper that's saying, you know what, CSF buildup on the brain and calvarial thickening seems to have a relationship with Alzheimer and autism. How many people talk about it? Not a lot, because they're not looking at it. Headaches are important. Huge.
Yeah, very.
Are you starting to see how I ask questions that is going to overarching? What are your big stones? Because if in fact, and what makes it go away? Sleeping, medications, what makes it go away? Very important. And then we're going to start asking about the environment. Food sensitivity and medical allergies. Tell me what you're sensitive to. An immune system that cannot respond properly to the environmental pathogens is a system that is debilitated, dysautonomia. Every one of these questions tells me dysautonomia, sympathetic overdrive, vagal tone that is not functioning. When you have allergy, food sensitivity and allergy, you're not in rest and digest. You cannot process food and hormones properly. Rest, digest, ventral vagal is not working properly. You're painting the picture, and the patient is doing it for you. You're not. You're giving them the paintbrush and say, I'm going to sit back here and you paint. Oh my gosh, you're a basket case in these categories. You see, we're on page 2. We already know a lot more about this patient, don't we? Now we're going to ask about orthopedics. You see, what are your gravels? What are your gravels? Now let's see what are the big stones that cause those gravels. And then we find out what are the things you do with your fascia and your nervous system and your life choices, the sand and the water, to fill the gap in between just so you can exist, right? That's it. We're having a jar, we're filling it up. First, we're going to find out the big stones. The big stones, orthopedic. Now we're going to ask questions. Tell me about history. Did you have orthodontics? Oral appliance therapies, TMJ orthotics, night guards? Tell me about it. Pour your heart out. What has been done? What didn't work? Dentally, what has happened in your mouth? And after all, you're a dentist. The history of orthodontics is super important, and the most important of which, headgears. Did you receive palate expanders and extraction retractions? Very important questions. Each one of those are a major, major, major trauma on the skull, and we're not putting enough emphasis on it. Retraction orthodontics with the headgears is probably the most devastating thing that happens to this part of the skull during growth and development. When the skull gets jammed, be aware that patient automatically gets a high score. I have seen distortion in the sphenoid maxillary palatine complex, which took 4 providers to get the patient to state of functioning because of the retraction techniques. It is a devastating thing that happens. And I'm praying that we can get dentists enough to know, stop doing these barbaric treatments. Barbaric. We are changing the durofascial system. We're messing with the nervous system when we are working on the mouth during growth and development, the most important, which is 12 years old. Oh, don't do anything about them when they're growing. Wait till they're 8 to 12 years old. We start doing those, limit their skull movement. Dr. Jocelyn, I have seen a 16-year-old going into seizures right after braces went on because of that restriction. Seizure, not one time, multiple times. The child's nervous system gets shut down because the skull is not moving by virtue of those wires and retractions. Very important.
And they never thought about the braces.
Oh God, no, they don't. No, there's no relationship, because orthodontists decided that there's no correlation between mouth and teeth are just, enamel post. That's what they are. No, teeth have periodontal ligaments. The periodontal ligament sutures, the fibers, the Sharpie fibers in the periodontal sutures are exact same proprioception as every single one of the squamous sutures in your skull. You can consider, as a matter of fact, this is the correct term, occlusion and periodontal ligament is an extension of the sutures in the skull. Period. End of the story. Neurologically speaking, your 4 front teeth are an extension of your prefrontal cortex. Teeth are not just enamel posts. They're part of your neurology and proprioception. We know that. But why are we denying it? Because we have been taught in allopathy, the biggest lie, that teeth are just an independent organ. They come in for chewing. Incorrect. We don't chew until we're 2 years old. We walk, we speak, we swallow, all of those things. Those are functionalities of the teeth, and yet we are not even focusing on them. We're not even talking about them. We are neurologists. Dentists are neurologists of the highest order. Another good book. I have a whole bunch of dental distress syndrome.
Dental distress syndrome.
Dr. A.C. Fonder wrote this book, very simple read, that talks about how our medical system has failed to put dentists to where exactly they belong, and how much of the functionalities of the body and hormone and posture is all related to the teeth and malady.
What's the name of that doctor?
Dr. A.C. Fonder. He passed away. Actually, I have a 5-hour video of him. I have uploaded to my YouTube. I'll send you the link to listen to this guy. He does a lot of kinesiology testing. 100 years ago, we knew this. Why did it take so long for you and I to learn? Because there's a wall of allopathic, mechanical between us and the real profession.
Yeah,
that's
exactly.
And I'm going to hold the dental profession to the highest order that we are ordained to do. And if you want to argue with me about it, God bless you. Next. That's why I cherish doctors like you. There's not very many of you guys out there. You've been brainwashed. Now, I'm not denying that most of us are brainwashed and we have to have time to process. The layers of onion and that thick skull needs to move, right? I get it. But for me, I had to walk through barbed wires to discover this. And that's a part of audacity that I had. And I felt like that was my job to do for my profession. And I'm putting the dues in because a lot of the doctors don't have the resource. They don't know where to go. And for that matter, the intelligence, they don't. And I was just blessed that I didn't need to worry about doing dentistry. And I went and discovered. And when I did, I'm thinking, okay, I know the importance of how this became what it is. This is the front, like this, right?
Yeah.
But can I just keep this to myself only? No, because we discover more together. I'm barely scratching the surface. We're going to discover way more together once you know what you're looking at. This is about the language. I'm teaching you the language. I'm not teaching you techniques. We're talking autonomics. Now, when you get to the sleep pathology, now you understand who that patient is, right? Because they told you, I'm hormonally off, lifestyle sucks, I don't get sunshine. I eat poor food. I make poor choices. I'm in a horrible relationship. I was born with a cesarean and I did not have it all together. And then they stuck my skull with these braces. Now you understand who I am. Human beings are a one cell, one tiny cell with all the genetic codes written in our DNA. Half of the chromosome we got from mom and half from dad became this one cell that was supposed to be folded up. The environment signals that cell to get folded up to become an origami. I'm just giving you a very simple example. When the environment produces cortisol and stressors from outside, and the wrong genetic in response to those stressors are turned on for survival, instead of the forces turning and folding this, does this. Okay, that's your amniotic cortisol. Mom that does not have good nutrition, mom that is sedentary, breached baby, mom's pelvis is distorted. This is how the baby forms. Mom is overexposed to prenatal folic acid and basically tongue tie. The palate is not forming properly in the womb. The first breath is like this. Okay, that's your newborn. We're not even talking about your 5-year-old, 24-year-old. Your 24-year-old on medication, that's how she formed. And then she can't breastfeed, she can't walk, she can't breathe, she got braces. Like this, more stressor come in, we get all, like, we internally have the genetic to put pressure, to put what it takes against the stressors from outside, mentally, emotionally, physically. Mentally, chemically, physically, all three stressors. We deal with it with our genetic. We turned on the genes that are survival called cancer gene, because we don't have the stressors way more than what we can handle. Now we're perpetually in the state of survival, okay? The goal is to work collaboratively to get this back to state of genetic potential. Yes, we're gonna have trauma left over. It's never gonna be 100%. However, we have a better chance at this than we did before, didn't we? That's the state of patience. Now, who's gonna be do we pull on what gives when we're trying to undo this? No, we ask the body, where are you stuck? Where are you stuck? When that emotion happened, when you were cesarean delivered, and believe it or not, children at birth, they internalize things just from the birth alone. And that's why I love craniosacral therapies for children, to work on distortion of the skull and this neurology and this tension that's in dura, because the more tension there is, the more nervous system has to overwork and fires as a colicky babies. They cannot breastfeed. Their bodies is in dorsal vagal. And what do? Vaccinate them, which is the worst thing we can do to a child. Expose them to all this toxicity. Like, our children are born and operate in dorsal vagal. I'm not kidding you. And the more we dig into this, now you understand we're dealing with a devastating issue that, yes, it is treatable only if we recognize that it's there. The only way we can remove a problem is that there's a pink elephant in the room. And now you and I are talking about it. Look, we're barely now making it at the middle of the page 2. You see how amazing people are? And by the time you get to about sleep pathology, you ask the right questions. Don't bombard them. Do you have good sleep hygiene? If they don't, they need to work on that. If you're looking at the screen right before you go to bed and you have cell phone sitting right next to you and you don't have a quiet room, clean room, what have you, you have a night shift, that's a sleep hygiene. And part of that is also getting enough sunshine, getting looking at the sky. If you have glasses all the time, those are things that actually disrupt your sleep hygiene. Discontinuation of use of blue screen, admit it. These are the things that contribute to your sleep quality. Eating at least 3 hours before time, glucose and insulin and cortisol go together for the sleep cycle to initiate itself. For going through the first stage, we need to have at least 3 hours before. Ideally, after the sunset, after the sun goes down, you should not be eating. That's ideal. Alcohol use can cause a lot of congestion in the nose and closing of the throat and disruption of the sleep cycle. And
alcohol cause mucus in your sinus.
Oh, absolutely, absolutely. I mean, alcohol is the worst thing you can have, especially before bed. Just alcohol altogether, it's just not good choice.
Yeah, I know.
Sunshine, again, I ask the sunshine, so taking sleep aids, you need to know this right out of the gate, because the goal is to get them off of it. Are you get to sleep? Again, I ask directly sleep cycle. Can you get to sleep easily? Can you stay asleep? Can you transition? I'm up every day at 3 in the morning. Cortisol. Dutch test, hormonal imbalance. You have no idea how many women that have estrogen overload and they have methylation issue in terms of eliminating it. They have problem with sleep transitions. Cortisol level are off. So at 3 in the morning, every night they're up. Do you think that's a breathing issue? If it is, and every night at 3 in the morning, that's speaking volume. Then you know where to direct them because, okay, we're going to address this, but this is another set of issue. You have a bucket of problem here, the biggest fire, but we're going to address this too. Sleep cycle, maintenance, sleep transition, and sleep initiation. Onset of sleep, maintenance of sleep, insomnia is a completely different order. I'm not denying that can be related to the skull bones, drainage of the lymphatics, because if the CSF is not flowing or there's concussion, the brain wave's going to change. If you're constantly in one brain wave and you're not transitioning to delta, that's also orthopedic. But you can't make assumptions. Does it look like a duck? Quack like a duck. Do you have enough evidence for this crime? If not, then maybe it's not what it is. And history, what has been done. You see, all of these are, to me, if they say no to all those questions and they had CPAP or anything that failed, you know what? I used to take 2 tablets, one like tiny bit of melatonin, but now I have to up my game. I have to take like 10 milligrams. That's a lot. That's a lot. We want to get
that's
really
a
off of
lot.
it. Yes. Have you, if they say yes to sleep aid, ask deeper questions. Do you take CBD? Do you take Delta, what do they call them? Delta sleep, whatever, the pills, CBDs, and smoking weed recreational. Ask them, what do you do? Meditation, things that they do. You ask an open-ended question and let them talk. Physical medicine, now this is very important, hugely important for you, because if they already are seeing chiropractor, PT, or history, why? Why? Ask why till there's no why. This is where if they say yes, you need to dig deeper. Where do they make adjustment? Oh, I see chiropractor, they always adjust this upper cervical and lumbar. Oops. You know that they're falling apart because especially upper and lower part of the spine, those are places that things go to break. If they are non-responsive to lumbar spine treatment from a chiropractor, your job just became a little harder. So do you currently see someone? How long have you been seeing them? How often? Where do they adjust? You see what I'm saying? These are the questions that's going to tell them, ooh, this is a smart dentist. And you explain to them, your mouth is an extension of your spine. When your mouth comes together, when you stand up, your head is sitting on top of your spine. Is it true or not? Yes. And when your teeth come together, it closes your chin with your skull. Is it true or yes? Yes. Okay. So if you have any issues in your spine, your mouth is going to exacerbate it. This is why I'm asking the questions. Very simple. And they're like, oh yeah, you're right. Every time I swallow or every time that I'm standing up, I feel like this part right here kind of hurts. And they start telling you things that you would have not otherwise. I ask probing question and let people feel safe enough to give me the information, pearls. And this is how you came to me. And these are the people that I worked with to address you. And let's look at how many of your symptoms are still outstanding 2 years from now, 6 months from now, 3 months from now. And then physical therapists, massage therapists, some of them don't go to chiropractor because they don't believe in it, but they go to a therapist, massage therapist every week. What are they doing? They're working on their fascia, their electricity and voltage. Paresthesia and fingers. Why is this one important? Super, super, super important if they have any tingling in their arms. That's speaking volume about upper cervical. Yep, upper cervical. If they have, especially if their mouth goes to one side, every time that they bite down, they're impinging the nerves between C1 and between C1, 2, and 3. A lot of the nerve goes into the arms and legs, kind of exit and enter. So the conduits of nerve could become affected, which, by the way, you, the wonderful orthopedist, dental orthopedist, can help them with. Thermal sensitivity in the arms and legs. Why is that important? Because if the body is in fact in the state of dorsal vagal, not ventral vagal, because polyvagal theory, dorsal vagal is that stage of sympathetic. It's not sympathetic. As primitive animals, we have 3 stages in our nervous system: fight, flight, rest, digest, and dorsal vagal.
Yeah.
Dorsal vagal is that blah, that overwhelm, that numb. It's that stage where body is basically peripherally vascularity becomes constricted. Numbness. Why? Because our brain thinks we were a prey, we did not flee, we can't go back to grazing, we're about to be somebody's lunch. If you're being eaten, your body will numb you, literally, so you don't feel being eaten. That's just one of the theories behind it. But you're in the state of overwhelm and numb. You can't process, so you shut down. And when the peripheries get shut down, that speaks so much about the state of nervous system. I feel always my fingers are cold. Last week, I actually met a medical doctor at the International Conference for Functional Medicine, and she said, oh yeah, and I looked at her face and all the distortions that there, and she says, I always feel cold. Yes, because you're stuck in a dorsal vagal, orthopedically. Mental, spiritual.
Vagal. Yeah, but also the hormones there is affecting very often women that they have cold finger.
Absolutely. So then we ask about mental, social, spiritual. First of all, social history, what do they do? You need to know that. Then we ask about functional health. Tell me about your digestion, gastrointestinal, gut issues, any known hormone imbalances. Females, we need to know if they cycle, if they're perimenopausal, postmenopausal. Dutch tests might go to at least once a year for females. Then you ask about occupational, chemical, physical, pathological stress, hobbies, what do they do to overcome that? A lot of people go for a run, they lift weight because they overcompensate with, oxytocin production, with the
Yeah.
Endorphin, right? You need to know, can you stop running? No, because if not, their body will shut, that's their compensation. And then mental, spiritual, do they have an outlet? If they don't, you need to know that. I know a lot of people that say, nope, I'm an atheist. You're disconnected from the source. I'm not here. I mean, I would love to evangelize to everyone, but here the thing is, if you do not have a spiritual path as a human, that's how we're wired. You are a cell separated from the source. Magnetically, you're short-circuited.
Yeah.
So then, you see how simple it was? I did not bombard them with many questions. Now here we are.
Okay, this question, are you sending them by email before
I
you meet
send them this questionnaire, it comes back to me answered. Exactly. And I sit there and I delve into every one of them with them. By the end of this, they're like, thank you. You just told me so much about myself. I had no idea. They drew the picture via questions they gave me. All I did was I observed and I gave them a safe environment to paint me the picture, to tell me who they are. Now we are saying, okay, what is in 3 buckets? What are your categories? So yes or no? This is the only time I have, you see there's codes after each one of these. These are medical codes we use. We're in the medical space, right? These are the codes that are recognized. R codes are what's reported by the patient. M codes are mostly questions that are basically still subjective, but it can be used as a part of our objective assessment. But that is what I use as a part of my, if I'm working with, let's say, an insurance, then we have a conviction about why am I doing this?
Sorry, come again. What is the R code?
R codes are reported by patients, self-reported hypotension, self-reported. If I come and tell you, Dr. Jocelyn, I was a cesarean delivery baby and I have had thyroid issues right here. My thyroid was enlarged 2 years ago. That's up to R code. Or I snore, or I have heavy breathing, chest breathing. That's self-reported, right?
Okay.
I did not discover that. You came and told me that. So headaches, so right here, you see there's an R. These are the latest RCD codes that are assigned to cephalgia. If they don't know what it is, these are the medical codes attached to it. It tells them what it is. Sleep deprivation, dyspnea, shortness of breath, snoring, fatigue, trismus, dizziness, discomfort, difficulty swallowing, mouth breathing, abnormal posture. All those answers is now leading them to, again, you see how I didn't ask about mouth breathing? Because if I would ask about mouth breathing, all they think about is like, oh my gosh, mouth breathing is causing that. Your mouth breathing is a byproduct of your orthopedic malalignment and your all the other things. Exactly. By this time, now I have gravels. The mouth breathing, autism, headache is all that fills in those spaces between the big scones and the gravels. They're not the starting point. For me to say, do you mouth breathe is saying umbrellas cause rain. I ask it at the end because now I tell you why you mouth breathe. Right? Guess what? We're going to take some pictures and I'll prove it to you. I put so much thought into this because everybody asking a million questions that there's no follow-up with. What does that mean? I need them to tell me the picture because when they hear, they're going to say yes or no. Okay, do you see now your muscle spasm, your tinnitus, your eye pain, your ear pain, your otalgia, nervous system, your nervous system from your digestion, right? All related. These are the things you came with.
So, sorry, come again. The M code is for what? The
M codes are usually related to muscle. H codes are related to neurology. And G codes are usually related to pain and like the source of pain. So these are the most relevant. There's more to the codes, but I picked the ones that are most relevant. At this point,
and the J code, sorry, I didn't get the J code
codes,
is pain.
I believe they are related to nervous system, like nerve and pain.
Okay.
Yeah.
Okay.
So 5-page of questionnaires, and I exactly know who that patient is. You see that?
Yeah,
and then
for sure.
Say, orthopedically, you're a basket case. You potentially is causing your problems in here as far as your digestion, your nervous system, your vagal tone, your vagal tone is affected and potentially sleeping, leading to sleep. Now I can tell you how those connecting the dots, right?
Yeah.
Connecting the dots. They do it, not you. They do it. Their body does it. Because when you ask in an open-ended question and provide a safe environment, the body tells you where it needs help.
Yeah,
They get
that's
to the
true.
middle of it, they start crying and say, I know that. I've had this happen many times. And when things don't go in the right order, you come back to the drawing board and say, okay, let's go ahead and address this one. I believe your body's not responding because of this. You have now a starting point. This is the baseline. If you never ask, it never happened. You can't go back and
Yes.
ask in the middle. By the way, do you have this? Why didn't you tell me in the beginning? Cover yourself, cover the patient, and ask the body what it needs. And these are the pictures. Now we're going to go ahead and talk about the picture and protocol, how to take them. And I need a profile. I would like to have both sides, a face and smile. And mostly I ask doctors put a wooden stick like the tongue blade between the teeth, have them stand up and take that picture. I need to know how the maxilla is related to the ground. I'd like to have both if you could, if not just the one side, if you can take both side profiles, matter of fact, I'd like them, front and back, and I'll tell you the protocol of how to take these posture pictures.
I would like to know, where did you get your grid?
You don't need one. I actually want you to use an app because if your floors are uneven, it will affect the way that it comes out. I use an app called Posture Screen, and I will tell you.
Yes, I have it. I have it.
Posture Screen. Posture Screen is you send.
Jocelyn is
If
better.
you
I
have the
agree.
Posture Screen, by the way, get excited because I'm working with Posture Screen to create. You see how I take the picture of face? I'm going to create augmented reality for the face with them. So you take the picture.
No kidding.
I'm working on that right now. Trust me.
That's great.
And I want the patient to take those pictures, not you. All these questions and pictures are being answered by the patient. When they come to you, the app is going to tell them you have orthopedic complexity of 5 out of 10, mental complexity of 10 out of 10, and you have digestive or you have hormone lifestyle balance of 8 out of 10. Which one is going to affect what? Like that algorithm is going to help the patient to see, look, you've got 3 problems. One is bigger than the other. One could be potentially a source of this. One might be related to coming after. Let's see how you respond to the first phase of treatment, set goals. In 3 months, if this isn't addressed, we're going to go back to the drawing board. Make patient a part of it.
Yes.
It's not you doing the treatment, it's the body telling you what they need. Always. Yeah. So Posture Screen, I do not like the grid at all because you see how the floor is uneven?
Yes, I know. I use Posture
Screen. Look, that makes no sense to me. Technology, hello, and it tells you, the report tells you the head stuck on the right.
Yeah, the report tells you everything.
Now that we're talking about this, the way you take the posture picture and CBCT, uber important. Why? Because I don't want them to pose for me. You see how I have feet, no shoes. I want to be able to see the ankles. More importantly, no shoes, no socks, okay? And I want to see the ankles. Have their feet, have two lines about a foot apart on the floor, like a midline. When you're as close as you can get that middle line in their pubic symphysis, and you put your feet about a foot apart from each other, straight forward. If there is a compensation in the ankle, which there is here, do you see how their feet are in turn? I don't want to hide that. I don't want them to assume their posture. If in fact there's a distortion, they take it right at the feet. I want them to not be able to compensate at the feet. And see how they shift their wrist. So have them stand up, loosen up your arms and legs. I have them swallow and loosen up their arms and legs. Close your eyes, keep your teeth together, and breathe for 10 seconds. Very important. If they cannot, obviously you want to give them support, make sure they don't fall over. And then have them 10 seconds of breathing through their nose and swallowing. Open up, look straight ahead and take the picture. Mock shot. You know why? I want to know how they support their head through their spine when their eyes are closed, so they're not adjusting to the horizon and their teeth are together for every swallow. That's the true picture of compensation. Those few clues I gave you give you the best diagnostics. So you know, sit down here, I can tell you head is shifted here, shoulders down here, hand is, those are pearls. If you can't have them tucked or shirt in, I want to be able to see, no hoodies, I want to be able to see shoulders. I need to absolutely be able to see the ears, earlobes. I want to see the forehead, no glasses. I want no hindrance in seeing ears, eyes, mouth, chin, nose, shoulder. Like all of those are really important. And posterior. So same way. Stand to the right, feet under you the same way. Close your eyes, breathe through your nose, 10 seconds. It takes 1 minute to take a good posture picture, but the value is amazing. Then you can reproduce that.
Yeah.
Now, when you're taking the pictures of the face, I have them smile, normal smile. Take a picture and have them bring their teeth edge to edge and take a picture. Very important, because where the mandible goes without molars, you need to know that. Where the mandible goes in according to the front teeth, It tells you where the mandible really wants to be. Where the mandible is in maximum intercuspation is where the molars tell it to be. Maxillas, both maxillas and the teeth, which have been potentially meddled with, the orthodontics, orthodontic surgery, with a lot of things that happen in their mouth. Look, this patient's midline line up, right? Doesn't.
Yeah.
Look, whenever
Doesn't
it
when
gets
it
to
come
instrument line goes,
forward.
the body goes, mandible really wants to be on the right side, not where
Yeah.
it is. But the orthodontist told me to put it here. Now, if this was all on the right side, the patient will have neurological issues. Right there, that is decoded. Like the mouth is the dial to the nervous system. I am not joking you. The midlines.
I believe you, but why the right side is worse than the left
Let me just
side?
really explain to you. This takes a whole day of course that I'm going to plan for you
Okay,
guys.
okay,
But
then.
to just give you a very short answer, right side of our body, we are asymmetrical in the middle of our torso. We're supposed to be symmetrical everywhere else, right? We are an asymmetrical functioning system that is like a pendulum, right? We're reciprocally cycling through gait. If everything was equal, do we ever propagate? No. We need a heavier side so we can pendulum and come back. We have liver on one side, heart on this side. Liver is on the right side. 99% of humans are liver on the right side. Heaviest organ in our torso. We have 3 lobes of lung here, 2 on this side. We have a larger diaphragm with more zone of opposition attachment to the rib cage on the right and the left. Are you starting to realize that the right side is our diaphragm stability and breathing real estate? Yep.
Yeah.
Now imagine if your body's contortion does not support you being functional on the right side, namely your skull is being contorted and you've been actually adapting with your pelvis to that. That means you had to walk and adapt yourself on the side of your body that is not supporting you all of that, the left side. Left side is not an inherent part of our brain. We are not, humans were dominant on the left brain and right hand, right eye. Now, if that system is reversed and you had to adapt to the other side, any bit of a change in your mouth, in your posture and orthotic will require you to redo everything to the left again. It is taxing, it is impossible, it messes with you, which body will lock up. When body cannot be in 3 dimension, it will lock up.
Yeah.
Your cerebellum says, I'm sorry, the information does not add. The mouth isn't mathing. I'm not getting the same information from the foot that I do with the mouth. What do? Lock up.
Yeah.
Do you think the breathing gets impeded? Yes, because you're using your chest.
Yes, for
You
sure.
don't have a diaphragm. Oh, your mouth breathing because your tongue is tight and your mouth is small. Isn't that ludicrous? Ludicrous. You are not the average dentist. You will not. By the time I'm done certifying you, all these doctors, they do not look at the small mouth and expansion, talking about retroglossal space. That language needs to be eradicated from dentistry. When we do orthopedics, we're orthopedists, we need to talk nervous system and orthopedist, not dental mechanic language that's being taught right there. And because another asked me, how is what you do different? Not the same, not even close. How is caviar the same as chicken wing? Not the same. A different level. You know, what you're doing, you're working side by side with chiropractors that are sacro-occipital technique trained, that they move the dural tissue in here, foramen magnum. Upper cervicals work a lot on the foramen magnum attachment of the dural tissue. You directly work the mouthpiece of it, which is right here. Actually, it's attached to the maxilla. Vomer. Let's talk about vomer. It's actually a good segue for me to talk about that. Are you keeping up with me, Dr. Jocelyn?
Yeah, I'm following you.
Good.
Just a second. I will turn on the light because I'm in the dark.
Oh my gosh, I noticed that. Okay.
Just a second.
You were in. Okay, pun intended here. You were in the dark, now you're in the light. Pun intended.
Yeah, now it's evening, so it's dark. Okay, I'm back.
I don't want to keep you up, but I know, like I said.
No, I like it. I am excited. I'm learning so much, and this is where I want to go for all my life.
So. Guess what? You're there, and I'm going to count on you being a coach for much younger doctors over there, because honestly, I can't be in every corner of the world, but I need ambassadors. And you are that, like I said, when I first met your energy, I'm like, she's the rock star I'm looking for. And you don't get biased. You're like, oh, I already know. And I told you about neuromuscular dentistry, and I tell you where it does not fit, right? Neuromuscular dentistry only got 50% correct. They miss the
Yeah,
other 50%. So
I agree.
basically, if I take the face off, okay, as a matter of fact, I want to send you a link to Amazon. I want you to get one of these.
Yeah, I would like to have buy
Okay.
one
This
actually.
is the best skull I have ever put my hands on. I'm
Okay.
going to take the temporal bones off. Let me
Yeah.
introduce you to cranial base. This is cranial base. And I love this one particular skull because it kept vomer purple as the occiput. Okay, so in osteopathy, they say this is the cranial base, okay? All the flexion extension as we breathe in and out, moving the spinal fluid, and the reciprocal movement of the tension membranes, they all happen in the SBS. They forget about a couple of other important conjunctures. One important one is, you ready for it? This amazing word called ethmoid. Do we talk enough about ethmoid? Because ethmoid, in collaboration with the sphenoid, control vomer, which smacks in the middle of the mouth. Now, this is where it gets exciting. You know the job of ethmoid? That's controlling all of your eosinophil production, self no self, immune system, the function of the breathing that is impacting your immune health happens in ethmoid. We know nasal breathing is important, but how? That's where all of that happens. And when that does not function, it gets inflamed. The attachment of the dura to the face is right here, attached to the body of the ethmoid, right here, called crista galli. Crista galli is in fact the front anchor, the posterior attachment of the dura that goes all the way through the superior sagittal sinus, where the major sinus drainage of the CSF is. Venous drainage happens to be right here, the posterior attachment right there in the middle of the occiput, called internal occipital protuberance, which in fact opposes the external occipital protuberance attached to the ligamentous nuca. So if the occiput and the head is in a particular extension or flexion, it affects the movement of the sinus and the ethmoid. So think about this vertical movement of the face and where it's distorted all the way down to the toes, right from there. These are realities. The anatomy would never understood what they mean. Let's talk about vomer. Vomer is a leash. It's that cartilaginous portion extension of the cranial base, because the vault is more like the squamole and membranous. This is cartilaginous. This is all cartilaginous, the cranial base, okay? This is the extension of the cartilaginous. The cartilage of the nose right here is the remaining portion. So this is not fully grown. As the face comes forward and grows in the proper direction, vomer is the leash that follows what's behind it, ethmoid, occiput, sphenoid body. When there is distortion in the body of the sphenoid, in the center of the flower being here, it gets reflected through the vomer in the mouth. One maxilla higher, internal, external. All right. So now we're talking about vomer. So when you see one nostril is wider, one nostril is smaller, and vomer is pointing to one direction and the tip of the nose, where is that vomer distorted? That's the part, because that should reflect the maxilla and the position. Like literally right here, where the chin and the nose are, it tells you where the sphenoid is, where the temporal bones are. One temporal bone is external, one temporal bone is internal. Ears will tell you that. One occiput is down and the head is down and the other one is up. Those are the nuances we're going to talk about later in a facial aspect with every patient, and you become an expert later, but just understand those dural meningeal tissues that the tentorium and the falx here, vertical and horizontal, are controlling where those features go. That alone is going to get you saying, oh, let's decode the face. Because once I understand that, then I know where the neurology is not working. And why the right side is more devastating, because when the right side doesn't function, the body has to triple work, quadruple work to make it work on the left side. And is less tolerant of change. Adaptive capacity goes down by multitude of factors when the right side patterns are present in a patient. And believe me, I have a practice full of patients that have been botched by orthodontists or wrong treatment in their spine or pelvis, and their pattern were on the right side. Practically every patient, I have seen them come from all over the world. I have patients come from, other countries, stay here in Boulder for me and my team to treat them. They were a right pattern. Never seen a left pattern get so botched, because your body has a lot more forgiveness and a lot less adaptive capacity loss on the left pattern. Why? I told you, because we're inherently humans meant to be on the right. So a lot we covered today. And what time is it? Hour and a half. I never thought I'm going to actually cover this much.
Yeah, but it's
So,
okay. I mean, I
so
don't know
this,
if you have time.
no, I mean, the fact is, no, it's a joy. It's a joy for me. And this is why I told Nader, I can do a lot of this remote, but at some point I have to show you and see you. I want to give you all the tools you need to go out there,
Yeah.
screen patients, work them up, get the record, and I will help you, the ones that are safe, get into treatment, build a team. November, we're talking November. I'll be out there and I will help you as patients are in treatment how to do this properly. We are getting another is actually one of the more amazing things he's done. He's trying to get us to collaborate with medical spaces in John Hopkins, Cleveland Clinic in Dubai. Like, I want you guys to be doctors in the middle of space with the medical doctors that works with the neurologist team, with the chiropractic team, with nutrition, functional medicine. That's the future. And that is
Yeah.
where I'm taking Vivo's appliances are dead center of the orthopedics and neurology. For once, I get a chance to talk about the total health, and the total health cannot exist when you do not understand what a total health looks like. Let's talk about
Wow.
how this is supposed to be. I keep throwing this around. Where this guy was supposed to be when sphenoid is not in the proper order. It is the one
Yeah.
bone that reflects everything else. It's the S bone in the cranium.
Yeah.
The next S bone down in the next triangle is the sternum, and the next one down from it is sacrum in the pelvis. Sacrum, sternum, sphenoid are the three signaling bones that get the three triangles propagating and gliding, and if they do not properly function, the domino stops and the thoracic spine right here, somewhere between T4, T12, somewhere in that area, the spine gets locked up. Thoracic spine, where your rib cage is the most mobile part, where you breathe in and out, and when the thoracic spine gets locked up because there's no correlation between the triangles, now you're sympathetically chest breathing. You see how that has some to do with the tongue tightness, but not really? And you can't just cut the tongue, tip of the iceberg, what's underneath. And this is where I want to get the dentist to stop just saying, oh, tongue tied, small mouth, small airway. Their nose is blocked. Okay, let's layer the, peel the onion, peel the onion, peel the onion. And the questionnaire I gave you, like I said, it took me 3 years to boil it down to those set of questions, and it works for me every single time. And by the time I get down to it, they're like, whatever I need to do, tell me what I need to do. I don't sell them any treatment. I don't sell them anything. They want to do. No, you want to just get by, get them a unilateral system or a Vida with a unilateral system, give them by right now. If they cannot afford it, they're not committed, get them educated. For that patient, maybe they're a year away from, maybe this one is, you always have something to get them started in their journey, even if it is just a consultation and plant a seed. And sometimes it's just a unilateral system or just a diet modification. By the time they come back to you, they're ready for those changes. And by the way, my philosophy is you have got to get the treatment, the cranium, at least somewhat in order before you start tongue therapy. I think tongue awareness and nasal breathing is the first stage. Get them to understand where the tip of the tongue is supposed to be. But doing all my functional therapy when the body is distorted, it just isn't going to happen. And I don't do releases out of the gate. I hardly ever recommend releases anymore. Stretching the fascia is probably one of the best ways, especially if you don't have a functioning diaphragm, if your pelvis is not working. Your tongue is your diaphragm when you don't have a diaphragm. Your tongue is your neck when you're lost lordosis in the neck. Your tongue is your occlusion when your occlusion doesn't work. Your tongue has 5 nerves attached to it. So it's that Allen wrench. It's that, the organ that does the job for everybody else. When as a bipedal animal, our information don't add up, the tongue comes in. And when one function picks up, the other one will suffer. That's why they can't swallow properly, which will affect the position of the hemial notch incisive papilla, the orientation of the front, the feather. I call this the feather to the rock. So how you orient your head has a lot to do with your tongue and hyoid bone in relationship to all the other neurology, because the tongue is wired bilaterally with 5 nerves. Accessory, like we have practically all the important mixed cranial nerves attached to the tongue. We have trigeminal nerve, we have vagus nerve, we have hypoglossal, we have glossopharyngeal. Like, imagine the importance of one organ. You gotta take it seriously. If your body puts so much emphasis on one thing, and we just cut it and release the jack in the box, this is where I get really kind of like angry about it. We're just looking at the tip of the iceberg and say, oh yeah, umbrellas cause rain, black shoes cause headache. Let's just start a campaign that we're not People should not be wearing black shoes because black shoes cause headaches. You and I can agree black shoes don't cause headaches. But when we say tongue tie and a small space is causing all these airway issues on soft food, we basically said nothing else is causing the problem, and all we gotta do is get them chew hard food and cut their tongue. And that's it. That's all they do. Okay.
Yeah, exactly.
Just remember that. You've been served. So,
Yeah.
Dr. Jocelyn, I'm hoping this was useful. I will go ahead and follow up
Yeah,
with an
very
email. Send you the link to properly take the CBCT, and the instructions are there. Also, instructions for taking the picture again. I will upload this video and I will send it to you with the recording so you can watch it again. And I will send you that form. I would love
Okay.
that if you can get those pictures, the questionnaire, if you have a sleep test, and I will send you a link through my website where you can upload them. And we're going to talk about how this all is going to get laid out. You're basically Dr. Zero. I'm just not waiting any longer. Dr. Arjun as
Okay.
well. So I'm going to
Yeah,
start
I
just
said,
working with you out of the gate, and we will figure out how complex your patient and where to start. I'm going to start just shipping the appliances from the get-go right now until we get things straight. But I'm excited for our patient zero, that 24-year-old you
yeah,
told me about, and the one that Nader said. Next week I should have time, and I will
yeah,
get this going for you.
good. Now, but I just wanted, Bahar, I just want to let you know, I'm going to be in Vivos for the course in July. I'm taking the frenectomy and
Are you coming to US?
yeah, I'm coming to Denver.
And you waited all this long to tell me that? Are
So,
you
but
kidding me
you
right
know,
now?
yes, I know. I have to tell you this because it was so funny. I said, okay, I'm going to take the frenectomy and I will take the sleep medicine in Vivos.
Uh-huh.
Then Nadia told me, oh, with Bahar, you will start to have training online. I said, but I'm going to go. He was so surprised that I was registered. So I said,
July
I
20,
already,
July when?
the 12th, so the 12th of July, I will be there
Uh-huh.
until the 4th, to the 5th, 16th.
Okay.
So I don't know. I was thinking, I will tell you,
I
I
want
don't
to
know
make
if
sure
you're
that
on
I spend a good
vacation.
amount of time with you between now and then. We can work upon our patients. You can pick up the appliances and take them with you.
Yes. Yeah,
And I would
exactly.
love to show you kinesiology tests. Like I said, I'm not waiting anymore. We got our appliances cleared. I have my rock stars, and I will be
Yes.
there in November, and I want to have a
Yeah.
good start. Dr. Jocelyn, I cannot tell you how much I need you to find a chiropractor that we can trade for you. And as
I work right now with an osteopath at the clinic.
osteopath is great as well, but SOT, sacrooccipital technique. And I tell you what, I know there are so many of them in England, in all over Europe. There's more SOT over there, but I'm just trying to,
I will ask him because
yeah,
he's from Portugal,
yeah,
and I'm not sure if I think he is. I'm not sure. I will ask him because
so
when I refer patient to him,
yeah,
he works on his neck and the cranium, and he
yes,
goes to the hip.
manipulation. I can want him to get inside the mouth, do manipulation. Also, one quick pointer for you: have the patients stand up, put both fingers with a glove, obviously between molars, and have them bite down and pull. Which one pulls out? They will tell you where they ground themselves in the mouth, virtue of that. And then when you look at their feet, it has to make sense. And I'll tell you what all that means.
Okay, good. So excited. But when we meet again online, when we
Well,
will,
get
I will
me,
send you the patient
yes,
after I
once you
have
have
the
your
picture.
records of your face patient, I will prepare your analytics. Like I said, let me just talk to Nader about nuances. We haven't really figured out a working
Yeah,
process.
I know, I know.
But guess what? What we're trying to do, instead of hosing down the doctors with training, we're going to give them some level of training, but we're going to make it very inexpensive. They will train as they go along. It's more of a coaching. You pay more for the coaching with the patient than you
Yeah,
do for the training. I think that makes a lot more sense. And it gives me a chance to actually hold your hand through 20 cases. Then you know, oh no, I can see it. All right, when it's not fitting the bill, then I will go to Bahar again. So you pay for the consulting for every patient rather than, and then that would basically get built into the appliance. That way
yes,
you're way safer to do the treatment. Because guess what? I could do this practically in my sleep. And I want to see what you see. And I want to see what your patients present with. Because I don't know what that region of the world has. I barely
yeah,
even know what region in this country has. So a lot
yes,
of
I
people
know.
in different populations, what is the most dysfunction they come with? Is it
Yeah,
neurological? Is it biochemical? Is it something in the food? You know, if all of them have the same disorders, what does it have to do with here, like developmentally than there?
Yeah, yeah,
This is the part that's going to be exciting to have doctors in all different parts of the world looking at the same thing and saying, I see more of that dysfunction than this dysfunction. Okay,
yeah,
this is something to be learned. And we will
yeah,
never know that if we never get out of our own area that we
yeah,
practice, right?
yeah, yeah.
So,
Now, that's what I want to ask you, Bahar, because I was thinking that I would like to go to your clinic and meet you in person,
my
either
clinic
the
is actually at the
15th.
Vivos Institute, and I will be sure to have few patients come through because I do follow-ups with them while you're here.
Okay.
That way I
And
have live coaching for you and a couple other doctors I've been coaching here. So I have like maybe a day. Actually, I'm going to orchestrate that. I have a day with all of you
I
guys
will
in
give you
person.
the dates, but we'll be there and
If
we'll
you could
see if
just
we can
be here
arrange
for
this.
a couple extra days, send me the dates again through email so that I
Yes.
can email these doctors and say, look, can you just come down and maybe I can have my SOT doctor also kind of be there to show you what it is I'm looking for. If I can organize
Okay.
that, that would be lovely. And I want to see if Dr.
Yeah.
Arjun can come over too. So I
But it
know
will be really great if we can do this.
it would be a party that I would throw and it makes me very
Yeah,
happy
that will
because
be great.
it would be
And
so.
also, I just want to ask you something because I wrote to Vivos and asked
Uh-huh.
them, okay, I want to have the training of Vivos so we can use DNA. They never answered me.
Well,
Never.
because they were not cleared over there, and we're trying to train you guys differently than here. We just
Yeah.
I mean, we just gave the pricing to another, and it doesn't seem to be very compatible, and it's a lot of hours. And I suggested, okay, let me handle that region, like what I just did with you. We start
Okay.
screening. I will teach you as you go along. We give you some level of understanding. Okay, what is the cranial distortion? What are the things the appliances can do? What are the other modalities? But once you understand to screen, you learn as you go. There's no way on
Yeah.
earth you can sit there for 60 hours and go through all this training. Believe me, it's been done. And you still don't get it. You learn
Yeah.
better if someone holds your hands through it. You don't need
Yes.
to know it
That's
all,
true.
you learn as you go. With the safety of
Yeah.
having someone coach you, and that's how you pay. You pay for consultations rather than pay for training and not know what to do with the training. I'm proposing
That's
that
makes
model. A
sense.
lot of people are like, oh yeah, absolutely. If I have a live patient that I want to treat and you help me with it, I can learn and I don't have to like invest my own dollars. Like I said, patients would be paying for your training because you've gone this far to want to do it better. Have them pay for it. You know what I'm saying?
Yes. I know. I
I
know. I
honestly
agree.
feel
Yeah.
like we're just putting so much pressure on us. I've been there. I've done that. I've spent thousands of dollars in training myself. And by the way, most of
Yeah.
them I had to just toss anyway. It was not good information and get more frustrated. And then I had to re-pattern and relearn it on my own anyway. I and I think, how can I make this journey shorter for you? This is how.
Great. Can
Everybody's
I
a
ask you
winner.
a book you can recommend me for the structural, I
Yes,
mean, the
with you,
brain?
I was thinking if you can do me a favor, take your own CBCT pictures, we can actually work up your own case too. Please do.
I, I was coming.
High five! Virtual high five!
This is great.
Like
Okay,
I
I will
said,
do this. I will do this.
at this point, I'm full-time consulting with doctors. This is what I
Yes.
do. I don't teach them, I consult with them. You have the brain to figure it out. You just need the
Yeah.
clues. Like this morning I gave you. You're like, I never thought about oxygen charging the voltage. That's
Yeah.
now you know. Now, when you look at someone, their sphenoid is off, they automatically think their voltage is down. And believe me,
Oh,
when we start working with the DNA, a lot of my cases, their eyes come online, voltage goes up, the eyes are like, oh my gosh, there's a spark in their eyes because the sphenoid is moving. Remember that. Every single freaking time the eyes come online, the voltage goes up. Sphenoid.
yeah, I believe you. I'm
Yeah.
so
Look
excited.
here.
Thank you so
Dr.
much,
Jocelyn, it's
Farah.
been a pleasure.
And have a great day.
I will follow up with an email, but it's night
Yeah.
tomorrow morning. Respond to it, the dates you're coming down, so we can coordinate a good time here so that you get the best bang for the buck. And I will be coming down to visit you guys
Yes, I
in
know. I
November.
cannot wait to see you in Dubai and show you
Me
Dubai.
too. I'm actually excited to come back. I haven't been there in 24 years. You know,
Yeah, yeah,
I
I
told Kirk
know.
I'm probably best suited doctor because I'm from the region. You know,
Yes, exactly. So that will be great. I'm
that,
sure
that
people will appreciate that.
absolutely. And I think there's a lot of synergy there. And I know you
Yeah.
guys are way more ready for holistic health. And I don't want to
Oh, yeah.
introduce Vivos
Yeah.
as a dental appliance. I want to come out of the gate. You guys are a medical provider. You're smack in the middle of medical treatments and own it. You're not taking another mad device or another dental treatment. You are owning your piece. We already done the job for you. That's what the FDA clearance was, to put the dentist, give them their seat in the medical team. Own it.
Yeah.
Don't let him tell you that you're just a,
A
plastic
dentist.
operator, babysitting the
Yeah.
plastic. No, my plastic is going to change their cerebellum and the way their brain functions. Take that. Can you do
Yeah.
that, medical doctors? No, you can't.
No, they can't. They
You
can't.
can't. There you go.
I'm
Perfect. Have
really
an amazing evening,
excited to go to
darling.
this area.
I know.
Thank you so much.
You're so
Thank you. Thank
welcome.
you. Thank you.
My pleasure.
Bye-bye.
Have a good night. Bye-bye.